Assalamu alaikum doctors, welcome to my YouTube channel MBBS and BDS lectures. Today is the third video of repair revision course of fixed partial denture prosthodontics, which is very important for NLE exam, MDS, NBDE as well as for BDS students. And especially this third video, Pontics, and its design is very important because in previous NLE March MCQs papers, the MCQs was come from this topic, like the most aesthetic pontic design, Ovate pontic, and second modified ridge lip, and third in posterior region sanitary or hygienic, and next is the modified sanitary and parallel. These MCQs was come from this topic in last March NLE exam. Mean this is very important. Now in Pontics and its design, because Pontic is the part of fixed partial denture. In first video we discuss about introduction of fixed partial denture and parts. In second video we cover retainers in detail. In this video we will cover Pontics, and in coming videos, next video we will discuss about connector and its type. Now first, Pontic. Pontic is an artificial tooth or teeth that replace the missing natural tooth or teeth to restore function, aesthetic, comfort and oral health. Pontic is attached to the retainer with the help of a connector. Now Pontic is attached with the retainer with the help of connector. Look at diagram. Connector connect the Pontic with retainer, and the connector which may be rigid or non-rigid. Now look at figure 22.4. Pontic is an artificial tooth replacing missing natural tooth. Now come to the definition of Pontic. Pontic is defined as an artificial tooth and a fixed dental prosthesis that replace a missing natural tooth, restore its function, and usually fill the space previously occupied by the clinical crown. Now, careful design selection is of utmost importance, as this will affect the function, aesthetic, oral hygiene maintenance, and patient comfort to a large extent. Now come to the requirements of Pontic. In the requirements of Pontic, it should restore function, it should provide good aesthetic to patient, it should be biologically acceptable, it should facilitate plaque control, it should provide comfort to the patient, it should have adequate strength, it should stabilize occlusion, it should not impinge or apply pressure on the underlying tissue like gingiva, mucosa. It should aid in preserving health of the underlying tissue. These are the requirements of Pontic. Now come to the Pontic design. Selection of appropriate Pontic design plays an important role in the success of treatment with fixed prosthesis. The design of Pontic is dedicated by restoring the form, function and appearance of the tooth that is replaced. The principal guiding design of the Pontic are the principles which guiding the design of the Pontic are the cleanability. Any design we will select, they should have cleanability, mean self-cleansable or cleansable with a dental floss. Second is the appearance, it should be aesthetic. Third, it should have a strength, because there will be forces, the occlusion forces which acting on Pontics. Now come to the factor affecting Pontic design. When we select the Pontic design, which factor affect the Pontic design? First is the tissue contact, because Pontic will contact with the oral mucosa tissue. The tissue contact, the area of tissue contact between the Pontic and the ridge should be small and passive in nature. Mean the area of tissue contact between Pontic and the ridge mucosa should be small and passive in nature. The area of Pontic contacting the tissue should be convex, and if possible should not contact. Why convex? In order to clean itself. If possible, should only contact the attached keratinized gingiva. The pontic should never apply pressure and be placed on the movable tissue, as it may cause inflammation or ulceration of the underlying tissue. Because in bridge, many patients complain after bridge, I have pain. This is due to impingement of soft tissue by pontics. Second factor which affects the pontic design is the interproximal embrasure. In interproximal embrasure, there should be sufficient clearance in the interproximal embrasure area to facilitate flaw control. Gingival embrasure should be made wide so as to allow cleaning. In the anterior region, the space provided is less. In interior region, the space provided is less in interproximal embrasure due to aesthetic. In posterior region, there will be more space per interproximal embrasure. This is again MCQ's point. In the interior region, the space provided per interproximal embrasure is less due to aesthetic, but in posterior region, there will be more. Next factor which affect the pontic design is the occlusal surface. The occlusal form of the pontic should correspond to the tooth it's replaced. Mean we should not give occlusal surface shape to posterior teeth while replacing the anterior teeth. Mean if we place pontic of molar shape in incisor region, there will be acquired. Therefore, any tooth we replace, the pontic shape will be of that tooth. Usually the width of the pontic, this is again MCQ's point, usually the width of the pontic should be 85% of the original teeth. Although it governed by factors such as strength of the abutment, a ridge form and contour and length of the edentulous span. Mean usually the width of the pontic should be 85% of the original tooth which we replace. Next is the length of the span. Longer the span of the fixed partial denture, more the stress will be imposed on the pontic and the connector. As the length of the span increase, there will be increased tendency of flexion of the fixed partial denture. Remember, when there is a long span breach, when forces acting on the fixed partial denture, in the result there will be flexion. Next is the material used. Choice of the material to fabricate pontic is very critical for the success of fixed restoration. The material should be biocompatible, rigid and aesthetic. Usually glazed porcelain. Remember, glazed porcelain, smooth, shining glazed porcelain are used for pontic. Contact is provided with a tissue for easier oral hygiene maintenance. If we usually we use glazed porcelain, contact is provided with the tissue for easier oral hygiene maintenance. Remember, glazed porcelain is the material of choice for pontic. Next is the ridge contour. Shape of the contour should be carefully studied to provide an aesthetically successful pontic. In most interior cases, modified ridge lap is usually recommended. In most interior cases, but the most aesthetic we will discuss further slides, which is the ovate is the most superior aesthetic. Second one is the modified ridge lap. In most interior cases, modified ridge lap is usually recommended, although in the posterior region more hygienic pontic design is desirable. These are the factors affecting pontic design. Now come to the classification of pontic. Pontics can be classified on the basis of following characteristics. Mean on the basis of three bases we classify the pontic. Number one, on the basis of mucosal contact. Either pontic contact with the mucosa or not. Second, material use. From which material the pontic is formed. Third, method of fabrication. On the basis of method of fabrication. Now here the first mucosal contact is classification is very important, but the second two classification, material use, the method of fabrication, is less important, but we will cover each and every one. Now first, on the basis of mucosal contact, There are two types. With mucosal contact mean they form contact with mucosa. Second is a without mucosal contact. With mucosal contact there are four types. Number one is the ridge lap. Second is the modified ridge lap. Third is a conical. Fourth is the ovate. And without mucosal contact there are two. Number one is sanitary or hygienic. Second is the modified sanitary. Now we will discuss one by one in detail. Second, on the basis of type of material used, there are all metal because Pontic is completely made of metal. Next is the metal and ceramic combination. Next is all ceramic. Next is the all acrylic resin, and next is the metal and acrylic resin combination. Next, on the basis of method of fabrication, there are customized Pontic, pre-fabricated Pontic, plate back Pontics, true Pontics, long pin facing, reverse pin facing, pon tips, modified pin facing, interchangeable facing. But in these types we will discuss only true Pontic, interchangeable facing, and pin Pontics. These three are important on the basis of method of fabrication. Now come to on the basis of mucosal contact. With mucosal contact, the first is the ridge lap. With mucosal contact, the first is the ridge lap, or also known as saddle Pontic. This is the ridge lap. Saddle or ridge lap Pontic with the large concave contact with the ridge. This saddle or ridge Pontics make a large contact with the ridge mucosa with the ridge, and they contact with the both facial and lingual surfaces. But here they block the embrasure area. The cleansing will be difficult. There will be no cleansing. There will be plaque accumulation and gingival and periodontal problem. Therefore, saddle or ridge lap Pontic is not used. Ridge lap means they make a connection with the ridge. Now, it is called ridge lap as it overlaps the ridge. Why it is called ridge lap? Because it overlaps the ridge. Both labially and lingually. It closely resembles the natural tooth because it replaces all the contours of the missing tooth. It closely resembles the natural tooth. It forms large concave contact with the ridge. This design obliterate the proximal, facial and lingual embrasures. They will block the embrasure, obliterate the embrasures. The biggest disadvantage of the design is that it is not possible to clean with the dental aids like floss. We cannot clean with the floss. Plaque accumulation leads to gingival inflammation. This design is not recommended or indicated in any area. We cannot give in anterior or posterior region. This is not recommended in any area. This is the ridge lap Pontic or saddle Pontic. Second type is the modified ridge lap. This is the second most aesthetic which are used in anterior region. This is the modified ridge lap with T-shaped contact with the ridge. They make a T-shaped contact with the ridge. How? Look at on the diagram. In T-shape, there is one is the vertical component of the T and one is the horizontal component. The vertical component contact with the ridge, and the horizontal component is the above. Now here, look at the modified ridge lap only contact on the one surface of the ridge, not on the both facial and lingual surface. Therefore, it is aesthetic and it is given in the anterior region. Now in modified ridge lap, in this design the Pontic contact the ridge only in the facial surface, to give an illusion of the tooth emerging from the gingiva. Why it is aesthetic? It gives an illusion like it's emerging from gingiva. The lingual surface does not contact the ridge and has convex surface to aid in cleaning. The lingual surface is not contact and have a convex surface to aid in cleaning. The tissue contacting area should always be convex as possible because it facilitates flow control. A rich contact of this pontic design is T-shape. Remember, T-shape. If MCQs come, which type of pontic contact make a T-shape? It is a modified ridge lip pontic. The vertical arm of the teeth ends at the crest, whereas the horizontal arms form the contact along the facial surface of the ridge. This is the most aesthetic design and is recommended commonly in the high aesthetic areas such as upper and lower anterior teeth, and upper premolars and first molar. Next come to the conical. Next is the conical. This is the conical or egg-shaped pontic, or also known as heart-shaped pontic, and it is given in the thin ridges, and it is not given in the thick ridges, because in thick ridges this cover the less area and the remaining area will be covered by plaque. It is also called egg-shaped, bullet-shaped, or heart-shaped pontic. It is looking like heart. It is rounded and provide good access for oral hygiene maintenance. It is indicated in the lower molar region with a thin ridges. Remember, this is a good point. Which type of pontic is given in a thin ridges? This is the heart shape, egg shape, conical. It is poor aesthetic and is therefore used in the area of minimal aesthetic concern. It has poor aesthetic. This design is not suitable for broad flat ridges. A small area of contact over broad ridges create area plaque accumulation, because they cover small area and the remaining area there will be plaque accumulation. This design was called Sanitary dummy by E.T. Tinker. Which design also known as Sanitary dummy? The conical, the bullet shape, the heart shape, the egg shape. Next come to the ovate. This is a superior aesthetic. This is the ovate, and this is placed surgically in the gingiva, and it looks like a natural tooth emerging from the gingiva. Ovate pontic lie passively in soft tissue depression of the ridge. This is a superior aesthetic, ovate. This design is superior aesthetic with negligible food entrapment and is easy to clean. This design gives as impression of tooth emerging from the gingiva. It looks like impression the tooth emerging from the gingiva. Its convex surface is rounded and lie in the soft tissue depression passively. This area is easy to clean and floss. The concavity and the ridge can be created. How we make this concavity? By placing a temporary tooth into the extracted socket, and it can also be surgically created in a pre-existing ridge cases. We make this area for pontic surgically. It is recommended in a highly aesthetic area such as maxillary incisor, canine and premolar. Its disadvantage is need for surgical preparation. It's required surgical preparation and extra cast. Remember, the disadvantage of ovate is the extra cast and surgical preparation, but it is highly aesthetic and given in the interior region and premolar. Why it is a high aesthetic ovate than modified ridge lap? Because modified ridge lap is given in the anterior region, also in first molar, lower anterior teeth, upper and lower, upper premolar and first molar are also given in the first molar, but it is given in the not in molar, in interior and premolars. Now come to the second types, which is the without mucosal contact. Without mucosal contact there are two types. One is the hygienic or sanitary pontics. Like sanitary means sanitization, sanitary pontics mean cleaning, sanitary. Now here with mucosal contact there are two types. One is the hygienic or sanitary pontic. This is hygienic or sanitary pontic. Second is a modified sanitary pontic, and this modified sanitary and sanitary both MCQs was come in last March annually exam. First is the hygienic or sanitary pontic. Look at the hygienic or sanitary pontic. This This type of design we give in posterior region, and there is the no contact with the mucosa. There is space between lower border of pontic and mucosa. This is a hygienic or sanitary pontic. There will be easily cleaning of the area. But here the lower surface is like a fish belly, and due to this fish belly design, the connector which connect pontic with the retainer, which is black, this will be thin and there will be fracture chances. Then in next we make a modified sanitary to change the lower border hyperbolic, and in the result there will be large size of connector, therefore there will be less chances of breakage. Now here hygienic or sanitary pontic, this design allows easy cleansing as there is a no contact with the residual ridge. It is usually recommended in anesthetic zones such as mandibular molar region. Pontic should be at least 3 mm thick occlusogingivally. Occlusogingivally it should be 3 mm thick to withstand forces. There should be adequate space below the pontic for cleaning or flossing. This design of the pontic is made convex both facial-lingually and mesiodistally. The under surface of the pontic is made round to facilitate easy flossing. This round under surface is referred as a fish belly because it looks like a fish belly. Disadvantage of the fish belly design is that the bulk of the connector is decreased. Here the bulk of connector, which is the black, is the decrease, and therefore strength is compromised. Remember, the sanitary or hygienic pontic is most cleansable due to its fish belly, lower surface like fish belly. But the disadvantage of the fish belly is its compromised its strength because the connector will be thin. Next come to the modified sanitary. Look at the modified sanitary here, also known as parallel pontic or modified sanitary. The lower border is like hyperbola shape, but the connector size is thick. Look at the black area. Here the connector size is thick. Here there is a look at this black area and this black area because this is thick. Now in modified sanitary pontic, this name was come, which is parallel pontics in last March annual exam. Modified sanitary pontic, it is also called arch fixed partial denture or modified sanitary pontic or parallel pontic. This pontic design is hyperbolic paraboloid shape. Hyperbolic paraboloid shape, like we discussed in the physics and math, where the tissue surface of the pontic form a concave archway mesiodistally. The size of the connector is increased here, which increases strength and also better access for cleaning. It is indicated in the non-aesthetic zones such as mandibular molar region. It is contraindicated in aesthetic area and area of reduced vertical dimension. Remember, if there is area of reduced vertical dimension, again it is contraindicated. This is all about classification on the basis of mucosal contact with or without. Now come to the second classification, which is on the basis of method of application. On the basis of method of application, first is the on the basis of method of application is the pre-fabricated pontic facing. Pre-fabricated. These are freely formed and they are available, and we buy according to the span and shape of the edentulous area. Then in prefabricated pontic facing there are types. Now these are commercially available porcelain facing, which are free formed and are adjusted according to the edentulous space. Some of the prefabricated design are: number one is the true pontic. Now what is true pontic? This is a true pontic in figure 22.13. In true pontic, the occlusal surface is made up of gold and the gingival surface is made up of porcelain, and in between there is a horizontal slot. This is the true pontic. But next is we will study the opposite of the true pontic is the steel pontic. In steel pontic, this is opposite of true pontic. In steel pontic, on the occlusal surface there is the porcelain, on the gingival surface the gold. But in the true pontic, the occlusal surface is gold and the gingival surface is porcelain. In true pontic, this can be used in both interior and posterior region. Occlusal surface is made up of gold and the tissue surface is made up of porcelain. This is a horizontal slot approaching from the lingual aspect which accommodates both the occlusal gold and porcelain. There is a horizontal slot. The strength to strengthen the gold supporting the pontic, bevel is given on the lingual aspect to increase its resistance to occlusal surfaces. Mean we give a bevel. What are the advantages and disadvantages of true pontic? The advantages is this has adequate strength, good aesthetic, because we can give in both interior and posterior region adequate strength, good aesthetic. Disadvantage, this should not be used where inter-arch space is less. Remember, when inter-arch space is less, we cannot give true pontic. Next, come to the steel spacing, which is the opposite of the true pontics. It is reverse of the true pontic. Here, gold contact the rich tissue and porcelain provide the occlusal surface. What are the advantages? Also, it is a horizontal slot on the lingual aspect for occlusal porcelain and tissue contact gold. What are the advantages? It is aesthetic, steel pacing. Disadvantages, it is weak, so it tends to fracture because there is porcelain on the occlusal surface which is weak and tends to fracture. Next, third type is a pin pontic. Here with pontic we give pin, like here is the we give a pin. This is a flat back interchangeable pontic, also known as pin pontic. But here in pin pontic, it is opposite of the true pontic and steel pontic. In true pontic and steel pontic, we give different types of material. One are occlusal, other on gingival surface. But here in pin or flat back interchangeable pontic, we give one material on facial surface and other on lingual surface. Here we give porcelain on the facial surface and gold on lingual surface with vertical slot. And also we can give pin for retention, therefore also known as pin pontic. It is the most versatile of the manufactured pontic design. It is used in a patient with limited inter-arch space. If limited inter-arch space, then the true pontic is contraindicated and we will give pin pontic. Here there are two pins projecting from the lingual aspect and reverted into the gold aids in retention. Good thickness of the gold is provided on the occlusal or incisal surface and glazed porcelain provide the tissue contact. It is also called interchangeable pontic. Last classification on the basis of material which we use for formation of the pontics. There are all metal. Look at A, there are all metal. In B, metal and ceramic. C, all ceramic. And D is the metal and acrylic. This is all about pontics, its design, its classification on the basis of mucosal contact with or without. In mucosal, with mucosal contact, there is a ridge lip, modified ridge lip, ovate, and heart shape, or conical. Mean four types. On the basis of without tissue contact, there is a sanitary or hygienic, and next is the peral or modified sanitary. And on the basis of fabrication, in prefabricated there is a true pontics, steel pontics, and pin pontics. And on the basis of material which found all metal, metal ceramic, all ceramic, metal and acrylic. And the most aesthetic is the ovate, and second most aesthetic is the modified ridge lip, and the non-recommended type is the ridge lip. And the pontic we can give both interior and posterior region is the true pontic, and where the less interocclusal space, the true pontic is contraindicated, and there we give pin or blade back interchangeable facing pontic. This is all about pontics. Now, if you now today our topic is complete. If you like my video, press the like button and share this video with your friends. If you new to my channel, subscribe my channel by pressing the red subscribe button, and also press the bell icon in order to receive my each new video notification. For watching my videos, I am very thankful to you. Thank you very much. In next video, we will discuss about connectors and its types.